Thank you and welcome to the panel of nursing professionals this evening. We have three awesome panelists here today, all nurses who are here to answer some questions and give you guys some advice. But before we get into that, I'm just going to go ahead and introduce myself really quick. Hi, my name is Danica. I'm the co-president of Irvine Valley College's Pre-Nursing Students Club, and I'll be one of the two people facilitating this panel.
Nice to meet you.
Hi, everyone. Thank you, Danica. My name is Victoria Mai. I'm a first year at Irvine Valley College, and I'm a public health sciences major. And I'm also the co-president of the Pre-Nursing Students Club here at IVC. And I'm so excited to help facilitate this nursing panel for you guys. So first question for our three nurses here. Could you please introduce yourself, your name, your profession, your years in your profession, and schools that you have attended?
Sure, I can start. My name is Brian, and I am a home health and former hospice nurse. Been a nurse for about 7 years. Really enjoy what I'm doing. It's kind of a as far as schools I've attended, it's kind of a long-winded and winding road. I started out at UC Irvine, withdrew because I didn't know what I was going to do. Went to IVC for a while, then went to OCC for a while, and then got back to UC Irvine and graduated with a bachelor's in biosci.
Hi, everyone. My name is Deniselle Tolentino, and I am currently working as a nurse practitioner now. But I originally went to school, also UC Irvine, but I actually have a degree in art history. That was my first degree. And then I decided to pursue nursing as a second career. So I actually went to Cal State LA for their accelerated BSN program. And then I worked as a nurse for about 3 years, and then also went to Cal State LA for my master's, and I now work in critical care as a acute care nurse practitioner. I have 3 years of RN experience, and I've been working as an NP for about 4 years now.
Hi everyone, my name is Lauren Dietz, and I'm a nurse practitioner, a family nurse practitioner, and I've been doing that for 4 years. I went to Chapman University and majored in health sciences. I did not know that I wanted to be a nurse when I entered undergrad. I just knew that I wanted to do something related to health. And then in undergrad decided that I wanted to pursue nursing. So I actually did a direct entry MSN program. So that's a 2-year program, and I did that at Vanderbilt in Nashville. And like I said, but I work actually at IVC Health Center as a nurse practitioner.
Thank you, everyone. Nice to meet you all. I guess we'll move on to the second question. The second question is, what are some rewarding aspects that come with being a nurse? Brian, if you could start.
Sure. So I can't really speak to the challenges of being a bedside nurse in the hospital. I've been a home health and hospice nurse for basically my entire career. But the vast majority of my interactions with my patients have been really, really positive. They're grateful for the care that they're getting from me. And I would say most of them, if not all, are happy to see me. It probably has to do more with the fact that they're not in the hospital, but still getting the care that they need. So that's been the rewarding part, is they're quite grateful. The kind of the bonus with home health is that they really welcome you into the home a lot of times. I've been given lunches, and not gifts as like in financial sense, but just like they'll ask me if I've had a meal, and they'll send me off with something. So that's been actually kind of a nice little perk.
So can you say the question one more time?
Yeah, of course. The question is, what are some rewarding aspects with being a nurse?
So for me personally, I've done bedside for about 3 years before I started working as a nurse practitioner, and I still work inpatient. So I feel like I still work closely with a lot of patients that are in-house who are hospitalized. And for me, a lot of the rewarding factors is just being able to be such a big part of patients' lives in their most vulnerable time. They don't want to be there, no one wants to be in the hospital, people are sick, and you have the ability to change a lot of how they have that experience. I work as a nurse practitioner now, so I'm more in a provider role, and I run with my patients, and it's short, multiple times during the day. But as a nurse, you get to be there at bedside throughout your entire shift, and you really get to know them, and you're the one who's spending a lot of time with them. So a lot of the rewarding parts for me was being able to get to know them and really making a difference in their hospital stay. And a lot of the times those patients remember the nurses and how great the nurses were. So you get to have that change in their lives. So that was really one.
Yeah, for me, I would say one of the most rewarding things about it is that you are helping people when they're sick, not feeling well, and you actually get to oftentimes see the results of what you're doing, and which is rare, I think. A lot of professions, you might help someone and you never see that person again, but in our field, they maybe come back, in primary care, what I work in, maybe they come back the next week or month, they're in 6 months and they're doing better. So I think that's really cool to see how the impact that you're having on people. And then also just the ability you have to help them in multiple ways, just beyond their health. I actually just, right before I got on this call, I had a patient who needs help with housing and with food as well. So you're able to have a unique connection with your patients, and they let you know some of the other problems that they're facing, and you can help them with those things as well. So that's really rewarding when you're able to assist them that way.
Okay, thank you guys for your responses. So the next question would be, what made you choose nursing as a career? So if anyone has an answer, feel free to unmute.
I can go again. I actually come from a family of nurses. My grandma's a nurse, my mom was a nurse, so it was something that was always in the back of my mind. But kind of then a part of me didn't want to choose it just because they were all it as well. But eventually I looked at a bunch of different health science careers, and I just thought that nursing would be the best way that I could help people, and then also use my passion for science. And I think another awesome thing about nursing is all of the options and opportunities within it. There's so many different specialties you can work in. You can work in the hospital, or you can work outside of the hospital. So it just gives you a lot of options, which I think is really nice when you're trying to decide what you want to do.
Thank you, Lauren. Brian, did you want to answer the question next?
Sure. So I did not know that I wanted to be a nurse. And I was initially going to go into dental school, and had graduated from UC Irvine, got my degree, was applying to dental school, got a job in a dental office as a dental assistant. Within a few months, realized I didn't want to be a dentist anymore. I didn't want to be a dentist for the rest of my life, and had to reevaluate what I wanted to do. I really, really enjoyed certain aspects of being a dental assistant. Patients would come in scared, in pain, and we would do our root canals, and they would be relieved of their pain. They would be so relieved and grateful for all the stuff that we did, and surprised by the lack of pain and the, I wouldn't say enjoyable experience, but the not the nightmare that they were expecting. So I enjoyed that aspect of it, helping people doing something that was hands-on. So thinking about what I wanted to do with that got me pointed in the right direction, and made me want to think that, okay, I'm going to have to go back to school and take a few classes and get towards nursing, and never look back.
So for me, I felt like it was multifactorial. The fact that, I really like working with people, but also, as Lauren said earlier, it does provide a lot of different options. You can pick a specialty. If you don't like it, you could switch to a different specialty, which is pretty rare, I guess, in medicine, if you're comparing it to medical school, for example. So you can do critical care if you want, or if you don't want to work inpatient, you can work outpatient in an office. You can teach, you can get your master's, and you can become a nurse practitioner and be more of that provider role. You can have different flexibilities in terms of your schedule. So if you want to work a 9 to 5 and have all your weekends off, you can do that. There are positions that are like that. Or if you want to work as a travel nurse and say maybe if making a little bit more money is something that you're interested in, like you have that option as well, and you can travel to different parts of the country. And I actually have a couple of friends who are working as nurses and nurse practitioners out in other countries as well, doing Doctors Without Borders. So there's so many different options and lifestyles that you can choose from. You can teach. So.
Okay, thank you guys for that insight. So then our next question would be, what are some tips to stand out as a nursing applicant when applying to nursing programs? Because as we all know, it's pretty competitive. So Lauren, if you could answer that question next, thank you.
Yeah, I think it's a good question. Definitely like volunteering in the hospitals is a great one. That, it gives you exposure to what the environment you potentially could be working is like, and just it shows your dedication. And then also similar shadowing experience, if you know someone, a nurse that you can shadow for a day, just to get a good picture of what it's like. And then another thing that I think is valuable is doing research with a professor. I think that's something that could help you maybe stand out from other applicants if you're involved with some sort of research project.
Yes, I'll say a couple things. So I definitely agree with Lauren on volunteering, working too. You can work somewhere in medicine. So I actually took a lot of my prerequisites at IBC before I went to nursing school, and this was after I graduated UC Irvine. While I was getting those prerequisites for nursing school, I was actually working as a medical assistant in a cardiology office. So I was building my medical experience there, and also volunteering at Hoag Hospital nearby, just so I can look at different units and make sure that this is what I want to do. What unit do I want to work in? Do I want to do inpatient or outpatient? And so getting good grades, obviously, that's a good one. But just trying to really expand your experience, working, volunteering, making sure the grades are top notch.
Yeah, I really just want to emphasize that, yes, being proactive and volunteering is the best way to go about it. It not only raises your profile, but it exposes you to all sorts of different experiences, different practices, and in a sense, sort of networking. So people recognize you. And to also make sure that even if you don't know what it is that you want to do, you want to try to get the best grades that you can to maintain good grades, so that way the grades will be a great way to keep your options open. You can apply to a lot of different programs. You can apply to local schools, apply to schools out of state. You can go to public programs. You can go to private schools. So grades will open a lot of doors for you. And life experiences, like Denzel said, she had experience as a medical assistant. I had experience as a dental assistant. That's a patient experience right there. That all that goes towards the scoring rubric for a lot of schools, and life experience, work experience, obviously grades, all that will work in your favor.
I want to add one more thing too, because trying to find something that is very unique to you. Brian, you mentioned something good with life experience. If you have something that you did that was very unique to you, that would also help you stand out. So if you studied abroad, if you did a medical mission somewhere, write about that in your essay and talk about how that affected you and why that maybe might have inspired you to become a nurse. So I actually studied abroad in Spain, and I kind of forgot that was where everything started. I volunteered in like a little pediatric hospital in Spain. And so like try to find something that not very many people do, or you find that is very unique and that can help you stand out, because there are a lot of applicants. So, a lot of people are going to be working and volunteering. So find even just an experience. Maybe you did go somewhere and you had a special experience there. Maybe it doesn't have to be medical. So just an idea.
Thank you guys for responding. So I know you guys mentioned that you guys went to competitive nursing schools. So the next question is, what were some challenges during your nursing school experience, and how did you overcome them? Denisel, I know you mentioned that you took classes at IVC, so a lot of community college students are trying to clear their prereqs right now to go into nursing school. So if you could elaborate on your experience, that would be great. Thank you.
Yeah, I felt like I hustled a lot to try to get to nursing school. That was my goal. And I worked full time as a medical assistant. And then I was actually taking a lot of classes on the side at IVC. And so my priority was to make sure that I had the best grades that I could, because when you think about when you apply to a lot of these schools, there's a lot of filters that go on, and sometimes they have like a cap on GPA. And so for me, I was trying to get into the biggest, pools that I could. So, work experience, but also trying to get really good grades. So I think the biggest challenge would probably be trying to balance everything, because it is hard when you're trying to work and gain experience and also get those really good grades. And so the biggest part was just trying to balance, never forget that you need time for yourself too, and mental health, and taking some rest breaks, just learning how to balance everything. I think for me was the most challenging. But just remember that it's going to be a journey. But even now when I look back, I'm like, oh my gosh, I can't believe that I actually did all of that, and I worked this hard to get here, and now I'm like at my dream job doing my position I've always wanted to do. So you will get there. It's just going to be a lot of work and a lot of hustling.
Thank you for that. Brian, Lauren, did you want to add anything?
Well, sure. So on top of everything that Denisel has said, which is all true, one of my challenges is that I'm not very tech savvy, and there was more than one instance where that got me into a little bit of trouble with my instructors, not getting my credentials to her in a timely manner, or at least long story, but not getting the credentials to her in a timely manner, and not being able to reach out and talk to her when I needed help. So the biggest thing would be also to ask a lot of questions, ask for help when you know your weaknesses, and find help to address those weaknesses. That helped me big time. Once I was able to overcome some of the stuff that we had to do as far as tech, I didn't really struggle as far as grades or anything else, but just learning how to go about doing addressing the technology aspect of it was a big deal for me.
And then one thing I'll add, I think they both made great points. one thing I found helpful in nursing school is just there's so much material. There's a lot of content, especially in pharmacology. You have to really learn a lot of information in a short amount of time. So I actually found like a study partner in my cohort that we would study together, and we would help sometimes like split up making study guides, and then share them with each other. So obviously we still had to study the material ourselves, but just kind of organizing it and having someone else to help with that was really, really beneficial for me. So if you can find like study partner or study group, just to help you're in school and learning all the information, because it is a lot to learn.
Yeah, I'd like to really emphasize what Lauren just said. Find some good study partners. They will help tremendously. You're going to bounce ideas off of them, information, quizzing each other, all that. Anything that will help you with repetition and approaching new ways of studying will be really beneficial to you.
Thank you, guys. Well, as everyone mentioned, nursing school is pretty stressful. So the next question is, how did you manage to take care of your mental health as a nursing student? If anyone would like to unmute and answer, go ahead. Thank you.
Oh gosh, so I really enjoy being active. So I made sure I was able to set aside some time during the week. Didn't have to be every day, but at least once or twice a week, either to go to the gym or to go running, go jogging with my run group. Obviously, nursing school dominates your schedule, but there's always room where you can find some time for yourself. And this is true whether you've started your career or in nursing or any other profession. You want to be able to have some time to yourself so that you can decompress.
I'm similar to Brian, where during nursing school, I actually brought a lot of my study materials to the gym just so that I could exercise. So just remembering to try and prioritize all of your basic needs. Remember to eat, sleep, exercise, walk outside, see the sun, and make sure that those are important things too, not just, burying yourself with books the entire day. And maybe schedule something that you might look forward to, like studying with a group of friends. You actually end up making a lot of friends in nursing school, which I think end up being lifelong friends. And a lot of that is through nursing group studies. And then you guys maybe can hang out afterwards, and it's something that you might look forward to if you're a social person. So just pretty much just trying to find your thing that makes you happy and also prioritizing that into your schedule.
Yeah, I definitely agree. And to piggyback off of what Deniselle said, nursing school friends are great because they understand what you're going through. Some family members and other friends, they might not get it, but nursing school friends get it. And so they are also on the same schedule as you. So planning things to do with them. It sounds like we had an active group, because I too like to work out during nursing school, and actually sometimes my nursing school friends, we would all go to a workout class or something together when we could. And yeah, just the normal self-care things of, like they mentioned, eating healthy, getting enough sleep, taking study breaks when you need them, reaching out to family too for support. And then I always like to have, not that this is always doable in nursing school, but like a trip planned or something like that you can look forward to. So yeah, just to help motivate you.
And this may sound really cheesy, but you do keep these friends from nursing school for life. If the friends that I made in nursing school, we still have Friendsgiving dinners. And once a year, we try to get together at least twice a year. We're going to their wedding. Some of us are going to be the girls in the group, they're going to be bridesmaids in the wedding. So it's important, and it may be difficult to make friends in nursing school because you feel you're competing with everyone. But try not to think of it that way. You're not competing against your classmates. You're just competing to get past that NCLEX and get that career.
Hey, thank you guys for sharing all your advice and stories. So our next question would be, what specialty did you start out in, and how did you know which specialty was right for you?
Guess I'll start. So volunteering is very helpful. If you volunteer at a hospital, it can help really try to narrow what kind of specialty that you want to go to. When I started, I did a year of med surg, a year of telemetry. So this was all inside the hospital, and just basic, like your basic hospital level, I guess, I don't know how else you can describe what like a med surg level is. And then after that, when I was in NP school, I actually started as an FNP, and then I didn't realize how much I really liked doing critical care or being in that critical care setting until when you're rounding and like when you're in nursing school, they actually take you to a lot of different units. And when they put you in the ER or in the ICU, you get to see how these professionals are, in their own zone. And I remember seeing an NP actually specifically in the ER just managing and leading this group of people. She was leading a code blue, and with someone's heart stopped, he had to do CPR, and this person was actually leading it, and it was so calm. And I remember looking at that and saying that I wanted to be that person. I wanted to be the person who was leading a group of people. I wanted to be that calm in an emergency. So maybe that is you. Maybe that you might want something a little bit that isn't as hectic. But for me, that's kind of how I chose the path that I'm in now, to where I started med surg, telemetry, then I did some critical care, and then, NP school, I really decided I want to work in a critical care setting. So just reminding people that you don't have to stay in your specialty forever. Even if you do it for 10 years, you can always switch, and you have that flexibility with nursing. So you're not stuck in it forever. Do what you want.
Thank you, Denisa. Lauren, would you like to share next?
Sure, yeah. So I was opposite of Denzel. I didn't really want to be in the hospital or in the critical care environment. I much preferred like the outpatient, which outpatient means like outside of the hospital. So like in a doctor's office where you get to work like 9 to 5 hours, like a more traditional schedule. So that's led me down the FNP route. And then just how I ended up in college health is one of my clinical rotations in nurse practitioner school was at a college health center. And so that's how I didn't even really know about this setting, but that's how I discovered this. And I really liked the college student population, and it's a lot of patient education, which is an aspect I really enjoy. So I think really just, you got to try different things and see what you like. And because sometimes you surprise yourself too, something you thought you wouldn't like, you do like, or something you thought you really were going to like, you don't like as much. But in nursing school, you get to go through all of your different clinical rotations and then be exposed to those different environments.
As for myself, I started out as an LVN and started out in hospice. Also got a second job as a field nurse for home health. Worked as an LVN for a couple of years, went back to school, got my RN, and I really enjoyed the flexibility of the home health experience. So stuck it out with them for a while, got a big pay raise and all that while I was applying to hospitals. And unfortunately, around that time, that was when COVID hit. So it was really, really stressful. and I was hearing a lot of horror stories from my friends who were in hospitals about, double workloads, if not triple workloads, a lot of additional risk. And because I had a family with young kids, we decided not to take the risk and put them at risk. If I were to come home with something, I decided I would stay in home health. And it's actually been really, really good because home health affords you a lot of flexibility. You can work 9 to 5, you can work longer if you like, you can work 4 days a week, 5 days a week, as many days as you want. You can work more than one job at one location. And it's, I'm not sure if I'm going to stay with home health. I do plan on going back and getting my BSN, and if things work out, getting my master's, but that would take a little while. But until then, I like what I'm doing right now. But I do also like variety. So maybe one of these days I'll switch up to something else.
Okay, awesome. Thank you, Brian. So our next question, I guess we kind of touched upon when we talked about mental health, but it's going to be, how would you balance work and life as a nurse? So if you guys have any just general overarching advice, please feel free to share and unmute.
So I think one of the really beautiful things about nurses, like their role and their position, is the schedule. There are a lot of different schedules. Again, we mentioned the 9 to 5, but there are a lot of people who work inpatient. If you do decide to work in the hospital, you have your 12-hour shifts 3 days a week. And so you have a lot of flexibility in terms of being able to travel. And when I worked bedside, I did travel a lot, and that helped a lot with my mental health. And because for me, I loved to travel and go places and camp and hike or whatever it is you want to do. To me, the schedule was very, very attractive. You can travel, there's always going to be someone who can fill in for you as well. And it'll be a lot easier for you to do longer trips. I also mentioned travel nursing to you guys before too. I know a lot of people who work 3 months at a time, and then they take 6 months off because you do get paid more as a travel nurse. I do want to mention that you do have to have some years of experience before you are able to start as a travel nurse. So there's a lot of options there as well. But for me, in terms, back when I was doing bedside, I was being able to really cherish the time off. Yes, those 3 days on that you work are a lot, even though don't listen to anybody that says 3 days a week is nothing. It's a lot of work. It's 12 hours. It's backbreaking work. And but you really need to cherish your time off and make sure to take at least a day to yourself to do whatever it is you need to do. Yeah.
So I guess as a general piece of advice is just to set your priorities. You don't want to be going out every other night to party or just stay out late and chill, do whatever. But to be more specific, I have friends who worked in the hospital, the 3 days, 3 days on of 12-hour shifts. And she would do a lot of traveling. She would plan what she called runcations. She loved to run, so she would plan trips to Chicago and run the race out there, run the marathon, come back, and sometimes come back the morning of her shift. And she being an athlete, she was able to to fly in and not miss a beat. She can also schedule her schedule so that as soon as her last shift was over, she can fly out that evening or that morning. So you can do a lot. You can travel. You have a lot of flexibility. It's a very, very rewarding and flexible field. So if you need time for yourself, you will be able to find it.
Yeah, I think they touched on a lot of good points. I think a lot of like the self-care type of things that apply for nursing school also apply for working as a nurse. One thing I really like to do after work is to go to like yoga or some sort of workout spin or some class on my way home. And that's something I enjoy doing. And then planning something like a concert or I like to travel to for the weekends. It's what I like to, how I balance it, I would say.
Thank you, everyone. Moving on to the next question. This is kind of specific, but do you have any tips for studying for the NCLEX? Brian, if you could start off.
Sure. I took UWorld test prep, and the way we had it set up was our whole class, we had something like 50 something students. About 40 of us got together and were able to get a group rate to study together. I'm sorry, to sign up, and we got a small discount. And in addition to practice tests, usually if you were to sign up individually, you would get one practice test. We were able to get 2 practice tests, and that you can see you can chart your progress a lot better. My first practice test, it showed that I had a slightly better than coin flip chance of passing. My second test showed that I probably would had about 85–90% chance of passing, just because UWorld is really good at prepping you for that. There are lots of test preps out there, Kaplan, UWorld, I forget some of the other ones, but I think any of them would be beneficial and help you.
Yeah, my school did a in-person review course, and I'm gonna be honest, I do not remember what it was called, but it was super helpful. It was 2 days. A person came and they gave us a workbook, and we just did this whole review, and then I just studied that workbook pretty much, and that's what I did. And then we also did a practice test. I'm not sure if it was UWorld, but we did a practice test as well, and it kind of broke down percentages of areas that would, to focus on that you were weaker in. So I did that. There was also an app that we had that had practice questions that I would, sometimes when you're in clinical at the hospital, it's kind of like a slower point, you can get on the app and do that. One piece of advice I would have is kind of like focus on yourself and what you need to do to study. I think sometimes in nursing school, people kind of panic about the NCLEX. Like I remember on the first day of school, people were talking about studying for the NCLEX, and I was like, what? We don't know anything yet. So I think sometimes there can be this like panic about the NCLEX, and other people can kind of fuel that. So just kind of, for me, it was important to be like, okay, like I have my study plan. I know what I'm gonna do, and not to get so caught up and kind of the excitement about it, because it is nerve-wracking, but your school really is going to want you to pass, because that is a reflection on them. So they set you up and they do a lot of things to help you to get there as well.
I don't have too much more to add. I used UWorld, and I did every single question that was on there. It is very helpful. It is a little discouraging because sometimes when you take a practice test, it'll tell you that you're not ready. And then when I took it, I passed it in 75 questions. I don't know if that's how it is now, but don't be discouraged, because study. And my other recommendation is pick a date and stick to it. I know people who kept thinking they weren't ready, so they kept delaying it. So right when you finish nursing school, if you can pick a date kind of close to when you finish, so that a lot of that information is fresh in your mind, stick to it, study really hard, and then pass it.
Oh, and another thing that I used was Quizlet, online Quizlet helped a lot.
Thank you guys for your responses. So I guess the final question for today is, what final advice would you give to students who wish to pursue a career in nursing, especially for students who don't feel confident yet in their skills and abilities. Yeah, if anyone wants to speak up, then that'd be great. Thank you.
I guess my one piece of advice is you guys, like, if you guys are interested, you know, you guys are obviously have some little interest here in nursing, if that's why you're here, but it's a really great field. I absolutely love it, and it's going to be hard, but it will, you'll get there, and just keep going. And you might have some rough roads along the way, and that's okay. I actually, when I first started, and I was over at UCI, my first degree, my first biology class, I received a D in it just because I didn't quite know how to study. And I worked really hard and ended up getting really good grades. And, you know, when I was in nursing school, I graduated pretty high up in the class. And so if you feel like you know, a little discouraged on some of the classes that it might be really tough, like, and even if you do end up not doing well in one of them, do it again, try it again. If this is really what you want to do, keep going and keep doing it, because you will get there. If you really want to do it, you can get there somehow. Just keep going. And then you'll be in a position where you are working as a nurse, and it's the most rewarding thing, and it's a great lifestyle, you know, keep going.
I should probably add, nobody's really good at anything right away. You know, it takes a lot of time, takes a lot of practice, especially like in the lab, the practicums and all that. Drawing IVs, starting IVs, none of that comes easy. You know, sometimes I still sweat trying to start an IV or draw blood. But that rule of thumb that says, you know, 10,000 hours to become an expert at anything, that's a pretty good rule of thumb. You know, give or take a couple, you know, 1,000 or 2,000 hours, but it just takes time and practice to become good at something. So if you're not good at something at first, just practice, and more practice. You will get there. I took a really roundabout way to become a nurse. I didn't know what I wanted to do as a career that pretty much was going to define my life until once I did, you know, understand that nursing was for me. I committed to it, and it's been wonderful.
Yeah, I'll add for people who are maybe feeling like not confident, or, you know, when you graduate from nursing, I think that's normal to feel that way. It is a little bit scary to go to work wherever it is that you're going to work as a new grad, but I just would say first that it's normal to be a little bit scared, and then second too, if you can find like a mentor or someone at work who you feel comfortable asking questions to, you know, that's really great. I've been grateful to have some really great mentors, and I've been able to ask them questions, and that's been really crucial in helping me feel more confident and just learn things, because there is so much in nursing that you couldn't possibly learn everything in nursing school. There is a lot of on-the-job type training, but you know, that's expected. They don't expect you to know every single thing when you start working, and you know, everyone was a new grad at one point too. And then just overall, I want to say, you know, it's a really great profession. I'm really happy with my choice to be in the nursing field, and yeah, I just encourage you to keep going for it. And it'll be challenging at times, but it's worth it.
All right, thank you guys for sharing on that last question. We do have some time until 5 o'clock. So if any of you guys are watching have any additional questions, please feel free to just like direct message me or Vicky, and then we'll go ahead and ask our panelists. You can just like also type it into the public chat as well. So I already have a question lined up actually. So to our panelists, would you guys say that there's anything bad about nursing? So if you have anything to share, like any stories, anything that stands out to you, please feel free to unmute and share.
I guess that would depend on how queasy you get. Some nurses don't particularly like blood or seeing wounds, penetrating wounds. I'm one of those. I don't like to see penetrating wounds, but I'm okay with doing wound care, strangely enough. So it just really kind of depends.
I guess some of the things that I've heard from my other friends or the ones who've been doing bedside for a long period of time is that there are some people who do experience burnout. And so a lot of what the people that I know who have experienced that, they switch to a different specialty or a whole different environment. They switch units. And so again, that goes along with the fact that you can change your environment that you work in within, even as a nurse. So you have a lot of options and you don't have to stay into one thing. But again, mental health is really important. You're taking care of people, you're taking care of human beings. And so you have to take care of yourself too, to be able to take care of others. And so just being very mindful of that.
Yeah, I think nursing can definitely be stressful. You're working with sick patients. So, that is stressful, but you definitely are always supported and have team members around you. And sometimes too, you just gotta trust your gut. If something feels off or you just don't feel right about a patient, then call your supervising doctor, call another colleague over, hey, can you just come look at this patient? I mean, we do that all the time at the health center here, and our patients are not critically ill, but just it's always nice sometimes to have someone else look. If you're just having a feeling like, there's something not right here.
Thank you, guys. Another question is, how do you know if nursing is the right career for you? If anyone wants to answer that.
I think we've talked a lot about, kind of ways to see if it's the right fit. Definitely like by volunteering, by working in the field. Another job is a certified nursing assistant or a CNA. So they actually work in the hospital and they help the nurses with patient care. They can take vitals, they can help the patients like go to the bathroom and different things. So that would be a great way. I would say that would be a CNA would be a really awesome way to see exactly what the nurse is doing in the hospital. Medical assistant as well. Also, EMT is another job where you're going to be working, in the medical field.
Yeah, to add on to that, there are so many fields of nursing that if you just want to be a nurse, there are as many different fields as there are specialties. So if you want to be in emergency medicine, you can go into the ER. There's the OR, which is the operating room. There's surgery. There's home health, family practice. As for every specialty out there, there's a nurse. And if you want to be a nurse, you will be able to find something that fits you.
Yeah, I agree with a lot of what Brian and Lauren had to say, because nursing is so broad. There's so many different types of positions. And so it's kind of hard to ask, how do you know if nursing is right for you? A lot of it is being able to, do you like working in medicine? Do you like, are you able to communicate with people and being able to help them? Is that rewarding for you? And so a lot of these are like introspective questions that you need to ask yourself as well, because you can find a position that you like because of the amount of options that you have within nursing. And so I haven't met someone yet who has regretted doing nursing. They've all loved it. If they didn't like what they did, they switched to a different specialty or switched to a different office. And so everyone has loved it so far.
Thank you guys. And then another question is that someone asked, is nursing good for mental health? Brian, if you wanted to start.
Nursing can be challenging, but if you also need to understand that patients are under a lot of stress. So try not to take anything personally. I guess what I'm trying to say is, grow thick skin. They are lashing out at you not because you're you, but because of their situation. So once you can understand that, then you understand that it's not really meant. It's not personal. They just needed some release valve, and you just happen to be it. And once you understand that in its own way is being able to help a patient, that actually is that's helpful too. And that also helps your mental well-being, because you know that they're not really doing it to be spiteful of you. They are just frustrated about what's going on with their situation, and they didn't know how any other way to express it. I've never really been yelled at or anything like that, but I can definitely understand when patients voice their frustrations. If you just listen to them, that is usually more than enough. That's what they're just looking for. That they want somebody who will listen and understand that they are under a lot of stress, and any little bit of help, any little I guess any humanity that you can offer them helps.
I guess I just want some clarification on the question. Is nursing good for like as the specialty for mental health, or is it in terms of like your own mental health?
I think the person is referring to, is it beneficial for your mental health as a person?
So I feel like with every occupation, there are always going to be challenges on mental health. Everyone has different challenges and different stressors that they're going through. So I feel like it's really hard to compare, like everyone's going to have their own stressors. And so I think what's really important is trying to make sure that your mental health is like you're taking care of your own mental health with any job that you do, but especially in medicine, because as Brian said, you are dealing with a lot of people who are in the most stressful time of their lives, and you're also seeing things that aren't normal. I work in critical care. As grim as it sounds, people are dying in front of me every single day. And so this is something that I make sure that I process, and then I know what works for me in terms of how I work through a lot of those things, because at the end of the day, what I witness is not a normal thing. And so being able to do all the things that are helpful, and so that I process a lot of those things. So it is hard. It's medicine. Medicine is difficult in terms of mental health. But on top of that, this is what, if this is a field that you want to go into, I love what I do, and so I make sure that I do take care of my mental health. Have a lot of support, go to therapy if you need. I think everyone in medicine needs to go to therapy, absolutely 100%. So just being able to take care of yourself first so that you can take care of other people.
Yeah, I think that's a really good point of taking care of yourself so you can take care of other people. It is challenging. So if you have a lot of stressors and things going on in your life, it's going to be hard for you to be there fully for your patients.
All right, thank you guys for all sharing. So I just have one more really quick question here. Are there any central job boards for nursing to help you find jobs in the field, or like a central job board to volunteer if you're thinking of becoming a nurse? So if you guys have any resources that you utilize, please feel free to share.
I guess what I did when I first started as a nurse is I signed up. Honestly, if you go on Google and try to sign up and be on the email list for whatever job that it is you're looking for. I wanted to work in inpatient in the ICU or in an ER. And so I signed up for every single hospital, every job website that you can think of. I put my name and my email list on there, and I was getting all these emails, and you just filter through on what you feel might be interested and apply to all of them. Apply and just, cast your net. In terms of volunteering, I cannot remember for the life of me the name of the volunteer group that I did, but it was through Hoag Hospital. If anyone here in this group, because I know we're all, it seems like we might be all for Orange County, but it was through Hoag Hospital. And they're the ones with the green shirts, if anyone knows, but I did the volunteer work through them, and they actually have multiple hospitals throughout Southern California that you can volunteer at. If I remember the name, I'll write it down in the chat.
Oh, someone put in the chat, Health Scholars.
Yes, that's what I did. That's what it was. Thank you.
Yeah. I volunteered at UCI Hospital in Orange, and I think I just Googled volunteer at a hospital in Orange County. I didn't go on anything, but then just applied for different ones. And you normally have to do like a TB test and maybe an interview or something. But it was a pretty easy process. I didn't have any connections there. And then I didn't work as an RN in the hospital, so I can't really speak on how to find those jobs, but for nurse practitioner jobs, a lot of it is networking. So, but this would apply to RN jobs too, like at your clinical rotations, making connections with the nurses there on those rotations. So that way when you're applying and they see your application, like, oh yeah, I remember they were on our floor. Or even when you do apply for a job at that hospital, reach out to that person and let them know that you're applying. So just really, kind of connecting with people in your community that are nurses and letting them know, or ask them if they've heard of anything, because sometimes it is through like word of mouth.
I want to add to that as well, because when you go through your clinical rotations in nursing school, a lot of the times it is how you get jobs. And so I would say whenever you do go through those and you are rounding in the hospital in nursing school, put on your best behavior, make sure people notice you, do 110%, and make sure that people are knowing that you're there, you want to work there, you are going to be good and you want to work. You're basically telling them, like, it's almost like an interview when you're going through these clinical rotations. So put on your best behavior when you're there, because those are also opportunities.
Especially
Oh, go ahead, Brian.
Okay. To add on to what Denzel said, when towards the end of the RN program, you are going to be working with a preceptor, and that right there is kind of like a small mock interview process, because if you impress your preceptor, he or she will recommend you to the director of nursing, or the charge nurse, or anywhere else that they'll point you in the right direction, and you can use them as a reference when you're applying. So work hard and impress your preceptor.
Okay. So it looks like it's 5 o'clock, and we're actually going to be closing out this panel in a minute, okay? And I just have a few final closing comments. But before I do that, I know that there's one student who mentioned, there's a lot of acronyms within nursing, and that is so true, okay? RN, BSN, FNP, family nurse practitioner, and so forth. Even for myself, who's been a counselor now for 15 years, I can't even keep up with all the nursing details, unless you're a nursing counselor who specializes in it. Okay, Okay. Okay. So if you are a student who is just kind of learning the different options and opportunities on that one, I know that earlier today at 10 o'clock, there was a session that gave a really good overview of the various nursing pathways and options, and also at your community college. If you're at a community college, please seek out either a nursing counselor if you have one. If not, there should be a few really seasoned counselors who do know the nursing pathway really well, and you could speak to them so they could begin to fill you in on some of the various pathways, so then you could begin to learn some of the acronyms, okay, in those areas. And specifically, even if your school doesn't have a nursing counselor, speak directly to the nursing programs directly and start reading up on that information.